All right, welcome, welcome, welcome. I'll just give everyone a second to transition out of the waiting room over to our first CE session of the day. I am very excited to hear this presentation with my colleagues and friends. A little sidebar, Michelle Felton and I, we have several Michelles here, but Michelle Felton and I are best friends. I'd like volunteered her that she was going to be my BFF because we have a shared likeness for reality television.
We
So
do. Mm.
we're best friends now. All right. Few people joining. I see our numbers climbing. So we will go ahead and get started. Welcome again, everyone. My name is Jamie Singletary, and I am the Senior Director of Clinical Brand Development and Community here at Within Health. And it is my pleasure to introduce our next speakers for our first CE presentation of the day. Again, this is a CE presentation. So if you are looking for credit, you must watch this presentation live. You will not receive credit if you go back and watch the video. If for any reason you have a technical issue, I will be placing CEGO's contact information in the chat. If there are any logistic questions about the summit, I will also have my contact information in the chat so that you can reach out to me directly. So without further ado, I'm going to read a little bit about today's presenters. First, I'm going to talk about my BFF, Michelle. Michelle is a licensed mental health counselor and certified eating disorder specialist supervisor with more than 15 years of experience working in the mental health field. She has developed and led eating disorder programs across all levels of care, from outpatient to residential treatment, with a focus on evidence-based, compassionate care. Michelle is extensively trained in DBT and family-based therapy and is passionate about empowering clients, families, and multidisciplinary teams to navigate the complexities of eating disorder recovery. Her work blends clinical expertise with a collaborative approach, helping clients build resilience, restore balance, reclaim their lives. And Kat is a registered dietitian and certified eating disorder specialist who specializes in nutrition therapy for athletes and individuals with eating disorders. She is a program dietitian at Within Health and also works in private practice in Seattle, Washington. Her background includes leading the first comprehensive sports nutrition program for Holy Names Academy rowing, providing care to Division II athletes at Seattle Pacific University, and delivering nutrition education to sports teams and coaches across the Seattle area. Kat's clinical experience includes 2 years at Partial Hospitalization Eating Disorder Center and over 1,200 hours of supervised medical nutrition therapy training at the top New York Presbyterian hospital systems. So without further ado, we'll turn it over to Michelle and Kat.
Thank you, Jamie. And hopefully at the end, if we have time, we'll take questions. So just drop them in the chat as we go, and Jamie will come back to them at the end of the presentation. All right.
Awesome. So we wanted to start off this presentation with an introduction into what is an athlete? Why are we here? Why are we spending an hour and a half talking about treating specifically athletes with eating disorders at a higher level of care? There are a few different definitions if you look them up, if you looked it up on Google versus the Oxford Dictionary, Merriam-Webster Dictionary, but a person who is proficient in sports, other forms of physical exercise, someone who's trained or skilled in exercises, sports, or games requiring physical strength, stamina. Um, and it's important to, it seems kind of like a silly thing to introduce, but also really important because we want to take into consideration, what what are the individualized needs for an athlete's experience when stepping into a higher level of care? What are we doing to support an athlete's return to sport, which is going to be part of our goal if that's also what an athlete wants to do? How is this going to form our expectations or approach at the clinical level? And for our purposes, like an individual who identifies themselves as an athlete, is participating in sport and performance, and that's a really big part of their life and identity. They're dedicating a significant amount of time, mental, physical, emotional energy to their sport. We want to take that into consideration.
All right, so before we kind of dive into a lot of what we do and like what to look for when working with athletes, we want to talk a little bit about why this work is important. So we won't deep dive into all the statistics and all the numbers, but I wanted to give you guys just like a little bit of high level what we're looking at. Because I think, when I first had interest in working with athletes, it was an undergrad. The research was very few and far between on studies with athletes with eating disorders. The best I could find was working with gymnasts and ballerinas. And then as kind of like the years have gone on and I've done this talk and like done more research on it, we've gotten so much more information, which I think is so interesting and so important because a lot of you in your private practices and your programs are going to get athletes in your program who struggle with disordered eating or eating disorders. So I think it's just important to know and be aware of this. So if you look at athletes from an endurance sport for female athletes, 46% of those athletes are at risk for developing an eating disorder. 21% of those athletes come from a team sport, and 47% of those athletes are strength training athletes. And then if you look at the males, which is very important because this is still often overlooked, 17% of males from an endurance sport were found to be at risk for developing an eating disorder. 47% of males from lean sports and 62% of males from non-lean sports reported engaging in weight control behaviors. So I think that's just important to keep in mind, especially when looking at your male clients, because I think a lot of times these behaviors get brushed under the rug as, well, that's just part of the sport. This is just like what wrestlers do, or this is what strength training does, and this is what distance running does. So I just think always kind of keep in your back of your mind to always be curious. And then further research shows that athletes have a higher prevalence of compulsive exercise, 6 to 9%, versus non-athletes at 3 to 7%. And then I just want to talk about the risk factors of sport here because sport can be a protective factor, and we know that, and I want to acknowledge that. But sport can also play a risk factor depending on the sport, the team environment, the culture of the team in general, because athletes are all subject to what we're all subject to in the day-to-day of risk of developing an eating disorder. So because they encounter like all general like risk factors for developing an eating disorder, they also encounter sport-specific factors for developing an eating disorder, which means they are 2 to 3 times more likely to develop an eating disorder than those who do not participate in sport. So I think that's really important to keep in mind as well, because I think a lot of times people just assume, well, they're an athlete, they have like different training, they know like what to avoid, what are the triggers, like what's healthy exercise, I'm using that in quotes, versus like non-healthy exercise. So I think it's always good to look at too, like team culture, and team culture often does times start with the coach. And so if there is a belief among coaches and athletes that leaner, thinner athletes perform better, people on the team are more likely to engage in ways to manipulate their weight, whether it's diet or exercise or looking for some other kind of ways to compensate. And even recent studies found that athletes who simply perceive pressure from their teammates to lose weight or to obtain a specific body type are more likely to engage in disordered eating or compulsive exercise. And that's important to say because I say like perceived pressure because sometimes people aren't putting the pressure on there, but it's just an assumption that athletes might be picking up based on the environment. So again, like I want to kind of blanket say, I'm not, and neither is Kat, ever specifically saying a team is at fault for an eating disorder or a coach is at fault for an eating disorder. These are all people who can play a role sometimes in the development of an eating disorder or have influence over an athlete. And that doesn't mean they're always going to be somebody who impacts them in that kind of way. And another thing to think about is like, how does the team talk about bodies, food, weight? Because that also plays a role. So if you have a team culture where it's a lot of body talk or a lot of food talk, you might have an athlete who came in who maybe didn't think about these things before they joined the team and now are very aware of these things and have the other risk factors of developing an eating disorder, therefore may develop an eating disorder because of this.
Yeah, we know that athletes are driven by strong external and internal pressures to achieve optimal performance. And there are, some amazing, characteristics and character traits that sports can build in athletes. Aside from the ones that I mentioned, that we mentioned here, leadership, teamwork, patience, respect, accountability, time management. There are so many positives, and there are quite a few different characteristics that really make athletes great and successful that can also be taken advantage of by the eating disorder. I sometimes describe with clients like there's this really like there can be this really gray fuzzy line between like, I am super dedicated, I'm doing everything that I possibly can in order to excel in my sport, to, kind of teetering over that line into, I feel anxious or worried if I'm not doing these really specific things. And now it feels like, there's the eating disorder is kind of taken over. So the mental toughness that we see in athletes to, push their bodies, it can lead to potentially ignoring or minimizing their physical symptoms. As an athlete training through pain and illness and struggling to take a break, or, take a step back in their training. The discipline that athletes demonstrate when an eating disorder develops, this can turn into perfectionism and this rigidity with black and white thinking. Coachability. This is a fantastic trait that athletes experience that teams and coaches really appreciate, and that can oftentimes blend into people pleasing and kind of, disconnecting or, not being able to honor what their needs are in order to make, maybe their coaches or teammates happy. Um, the dedication that they experience. This can result in a really narrowing of their identity. Like, is their sport their whole identity, 90% of their identity, outside of just also being a friend, student, child, sibling, teammate? Strong work ethic. This is one that's oftentimes overseen, that somebody's working so hard and they're, pushing themselves in this idea that more is always better, can lead to overexercise. And the competitiveness that athletes experience, this can really end up tying their self-worth, to their performance, and that can bleed into their self-worth being tied into their eating disorder and uphold a lot of these eating disorder behaviors that will have a negative impact ultimately on their performance.
So things we kind of want to look at here are signs of unbalanced exercise, and also when to consider a higher level of care, because we get asked this question a lot too about when to consider a higher level of care for an athlete. So we kind of made a list here just the things to look for. And the first is that exercise is the individual's primary means of coping. Exercise is a great outlet. It helps so much with mood, and it can help clear the mind. It gives the little like dopamine boost, but also it can't be the only tool you have in the toolbox. So you have to have other things you can rely on when you're stressed out, when you're anxious, when you're sad, when you're mad. There has to be something else you're going to. And for some people, we often just hear, well, I can't take an exercise break because it helps my mood so much. And like the rigidity around that, where it's like, yes, it does. And what other things can you do to help your mood? And if there's nothing else there, or there's nothing else that the athlete can kind of draw upon, that can be kind of a red flag, um, that something's going on with the relationship with exercise. Exercise despite injury. This is huge. And I feel like this is pretty controversial because a lot of times athletes are told to play through pain. The whole phrase like no pain, no gain was really popular for a while. Or like you're not being a team player if you take a break, or how is this going to impact the team? And there are aches and pains that are common for athletes. There's soreness in general, but you have to kind of look at like, is this a lingering injury? Why won't they take a step back? Is it perceived pressure from the team? Is it internal pressure? Is it worry about losing scholarship? Some of these things are very real external factors that can be worked with, especially like if scholarships and whatnot are involved. However, if it's the other concerns of body image, food, losing fitness, like there's a difference between losing a little bit of fitness when injured and in the off season, between this idea of what losing fitness means to somebody. And then withdrawal effects are sometimes seen in athletes who have a history of abusing exercise, when exercise can no longer happen. So if they're sick or they're injured or they're sidelined due to their eating disorder, we can see like a big shift in mood, the irritability, lack of sleep, typical withdrawal effects you might see in other places as well. And then overuse injuries or stress fractures. So the overuse injuries tend to be the tendinitises. Stress fractures are common as well. And then either menstrual irregularities in women or decreased testosterone levels in men. And loss of bone density. This is important. This is why the DEXA scans, the physicals, all these things are really helpful. And something that I think, I don't know, when I first learned about this a while ago, kind of surprised me was like the decrease in immunity. But if you think about it, it makes a lot of sense because if you're wearing your body down and you're not feeding yourself appropriately for the movement that you're doing, you're more susceptible to injury and illness. And then the frequent upper respiratory illnesses or colds makes a lot of sense. You're pushing yourself when you should be resting. Um, and then inflexibility of exercise schedule. This is for me like a favorite indicator because if someone has like, let's say like their schedule planned for the week and something comes up on a Tuesday where they can't execute that plan they already had, what happens? You know what I mean? Like maybe they get stuck at work late, or maybe they have to do a meeting for a group project, or anything gets in the way. Life gets in the way. What happens? How do they respond? Can they roll with it? Can they just shift it and maybe just now use that as a rest day? Take an extra rest day that week, modify the exercise? Or is it looking like canceling plans because of exercise, maybe missing the day, but then doing doubles another day? What's kind of going on with the mental flexibility? And then decreased performance in sport or overtraining syndrome. This you'll see a lot with athletes who are over-exercising and under-fueling because they're starting to feel like their body's starting to feel the impact of the exercise and the underfueling. So their sports performance is dropping off, which then kind of results in people then exercising or working out harder or training harder or doing extra. So it's this relationship where they have this idea of, I need to do more because my performance is plateauing, but the more is actually hurting. And if you do less, it actually might help the performance, which trying to explain that to an athlete who's like in the thick of it is can be really challenging. But really trying to explain just overtraining syndrome and what it is. It's a real thing if you look it up on the internet. And actually, in our group, somebody did bring that up, that Kat and I run, that she said, I think I'm suffering from overtraining syndrome. And for her, that was really eye-opening. And so I think, just giving this education to your athletes can be really helpful. And then looking at and trying to figure out like what is training versus overexercise. So for me, everything always comes down to intention. What was the intention behind that movement they did today? What was the intention of maybe doing the extra skill session after practice or adding the extra mile to the run? And you can really unpack the intentions too, because at surface level, someone might say, well, I just want to be better. I'm just trying to be the best on the team. You got to go deeper than that because underneath there's more beliefs about what that might mean. And so really kind of like I have this, always be curious mindset with my athletes and clients in general that really can like help get us to a place of, okay, you want to be the best on the team, but what does that mean to you? And what does it mean to you if you are not the best on the team? Because sometimes, and we'll talk about the aims later, but like over identifying as an athlete and that being your only identity can actually cause a lot of damage as well and set you up later to have issues maybe around exercise and food. So it's important to just always be curious with them. And then what is their training schedule? I think something that we do really well is that we will always ask to see an athlete's training schedule, because that'll tell us everything in some ways. If they won't share it with us, that tells you almost everything right there, actually. If they're willing to share it and then also sharing with us maybe like their movement data so we can see, are you actually following this training schedule or are you doing more? Are you making up for days where you felt like you didn't do enough? Or are you going harder on runs where you felt like maybe the day before was too easy? So the training schedule and their willingness to share it with you is so important. And then something else I always look at is how are they viewing food? Is food something they can only like consume when they're training? Is they only have food freedom when they're training? Because it's not just are they eating, it's the what are they eating, and do they only give themselves permission to like eat freely on days when they're exercising or in season where things are going a little harder. Um, and I guess on the flip side of that too is when someone is in season, are they really rigid about food and the types of food they're eating, which is where our sports dietitians come in so helpful. Just but always being curious and having that mindset with them about that. And then recovery days. This is Kat and I run a group together and we talked about rest days in our group. We talked about rest for two weeks actually, and it landed so flat for the group. We were so excited about it, and the group I think hated us because talking about rest was so uncomfortable for them. Just the idea of rest, what it meant, what is food looking like on rest days, what's their mood looking like? Are they anxious? Are they feeling higher levels of depression? Where is their eating disorder thoughts? Like, where is their thoughts around body image? It's really important to just dive into a rest day. Also, just asking about rest days in general. And what does a rest day mean, actually, on that note, too? Because a lot of times we'll be like, oh, yeah, no, 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 I take a rest day every week. And so you're like, oh, cool. But then if you don't ask further, you might not learn, well, my rest day is actually a cross training day, or I'm swimming, or I'm biking, or I'm walking 6 miles. So you have to kind of figure out just what that looks like for everyone. And then also, we do hear a lot sometimes of like, well, my coach has us on the cycle of 14 days training, 1 day off. That's can be problematic for a lot of reasons, and especially if you have an athlete in your care that's already come into you with disordered eating or an eating disorder, really then asking permission to like talk to the coach so you can kind of figure out this isn't going to be helpful for the athlete in their recovery. So like what can we do with this? And then just kind of more diving into the feelings around this. And I think that it's important to kind of probe a little harder on just kind of like if you're told like to back off the training. So when I've had runners that I've worked with, and they're like, hey, we need to actually decrease your running a little bit. On the surface, they're like, oh, okay, yeah, that's fine. And then you kind of let it simmer a little bit and or like and then maybe like, well, how long? And like, how many miles can I still do? And like, well, what's going to happen? They start to get all these like questions out, and it's interesting because like giving it space to like breathe a little bit when like talking about decreasing training, or maybe somebody can't train anymore, letting them have their space for that, and then also kind of then like probing a little bit of like what's coming up for you emotionally. Is it some of it might be guilt, associated with I put all this work in and like I feel really guilty that I'm withdrawing from the team, or I have to take a step back, or I feel like I'm letting people down. A lot of times we do see the like increase in anxiety, an increase in depression. And it can be a lot of like all or nothing thinking around it. So really trying to just get in and talk with them a little bit more about that. And also if you do have an athlete who has to take a step back, like for a long period of time, making sure you like kind of name and give space for they might be experiencing grief around this break, because a lot of our athletes have put a lot of energy, dedication, and work into their sport. And then we come in and are like, hey, so we actually need you to take a training break, which we usually try to decrease slowly if we know that's what's going to have to happen. But that still brings up a lot, and it can bring up grief and all the feelings that come around the loss of that, and maybe even experiencing a little bit of loss of identity. So just making sure you maybe name that for them. They might not be ready to kind of go there and talk about it there, but sometimes I just always say, like, hey, like, this might bring up a lot for you, and I just want you to think about that and kind of name the grief for them and let it sit, and then you might come back to it. Um, Something I like to ask my people too is what are you currently training for? Especially for my post-grad athletes. So when you have someone graduate from college who was a college athlete, there's a huge transition there. And they might still be going hard at the schedule they used to do because that's just what they're used to doing. But really needing to ask them, like, okay, what are you training for right now besides like life and living? You know, and if the answer is like, oh, I'm just exercising because I like it, like let's look at maybe where this can be flexible, or maybe like trying different types of exercise, you know, add some variety in, because there's no need for a runner to casually be running a 50 to 60 mileage week, like for no reason. So let's kind of look at, is there some flexibility in there? Um, and then really talking about, you know, I think sometimes when the eating disorder does eclipse a little bit into the sport, just talking about like what do you enjoy about your sport? And like I really like to tease that out because a lot of times there might be eating disorder driven reasons, but a lot of times there are still healthy self reasons in there. And the goal, like we don't want athletes to not have to do their sport anymore. What we want is to tease out what the eating disorder has maybe eclipsed and what they liked originally about the sport, and try to strengthen their healthy self and their identity around that. And, you know, eating disorder thoughts might come up while they're moving through recovery, but really trying to just acknowledge them, challenge them, and connect them to what they like about their sport in general. And then when trying to also talk with athletes about, hey, this exercise might not be serving you anymore in the way it used to, I do like to kind of hit on sometimes like, well, how do you feel like after you've engaged in this type of movement? Like physically, like if we're honest with ourselves, like how are you feeling post activity? And is it depleted? Is it tired? Is it that you have to then spend like hours recovering? You know, really tapping into like what's going on with them physically. Because I think a lot of times too, not just our athletes, our eating disorder clients as well, are sometimes really to like disengage from what they're physically feeling in their body and trying to like reconnect them with that.
So taking all of these things into consideration, some of the, signs of unbalanced exercise, how people are feeling about rest days, their relationship with food, diving into the emotions, as Michelle mentioned, like we want to start to take into consideration and tease out like what might be relative energy deficiency in sport versus, the development of an eating disorder, and how do we notice that, how do we know the difference? So Relative energy deficiency in sport, also called REDS, is it was first coined in 2014 by the International Olympic Committee, and identifying a syndrome of detrimental health and performance outcomes experienced by athletes who are experiencing low energy and availability. And on one side here, we have potential REDS outcomes, like health outcomes resulting from low energy availability. And then we also have the potential detrimental performance outcomes from low energy availability. And low energy availability is when there is a mismatch between energy intake and energy output in exercise or training that leaves the body's total energy needs unmet. So there's not enough energy to support the functions required by the body to maintain optimal health, on top of the demands with training and to support performance. Um, and oftentimes I'll hear from athletes too. It's like, well, I feel like I can get through my training session or my practice okay. Like I have enough energy for that. So therefore it must be fine. Like I'm confused, what might I be missing? And when we look at, okay, like tell me more about your whole day or your week. You feel like you can get through training, but then, oh, I'm feeling like I really need to rely on more caffeine in the afternoon to get through the rest of my day. Or I am struggling to focus in class or at work. After I eat dinner, when I get home, I'm just so exhausted. I feel like I can go to bed at 7 p.m. And it's just, I have difficulty concentrating and functioning. I'm feeling more fatigued outside of training sessions. That's also a sign that somebody might be experiencing REDS and low energy availability. Um, is our body is going to try to prioritize prioritize the energy needed for our highest energy expending thing during the day. And for, the athletes we work with, that's going to be their training sessions. So that's a really important thing to take into consideration. It's not only how they're feeling and how they're getting through their practices, training sessions, but also how they're feeling outside of that, because it can look different for each individual athlete. A really important consideration and differentiation between, like, because there's a lot of overlap between REDS and eating disorders. But some people who are experiencing REDS might not have an eating disorder. And sometimes REDS develops on accident, when there's unintentional underfueling happening. So maybe there's limited nutrition knowledge and people don't realize like what they really need. I would say majority of almost all athletes that I've worked with, outpatient, higher level of care, almost everyone is just, is below meeting their energy needs, whether they're coming in for support for disordered eating or an eating disorder or not. Um, Maybe there was a big increase in training without matching the increase in energy requirements. My college roommate, went from when we got to college, and as Division I runners, our training increased exponentially, and um, she noticed like there was a development in REDS, and it wasn't an intentional underfueling. It was like, wow, our training demands are so much higher in college than they were in high school. And I didn't realize like my body's needing a lot more. This is also really common because a lot of athletes can experience GI distress, and appetite suppression, especially after hard workouts, sometimes for hours afterwards. So there's this disconnect that can happen of like, I'm not really feeling hungry. And, okay, I'm also hearing maybe that this is an optimal time to fuel in order to better recover. So, building that knowledge can be really important. And when taking this into consideration, is it REDS? Is it disordered eating or an eating disorder? How does the athlete respond when they do get this knowledge from, their sports dietitian, from their therapist, and getting some education about REDS? Like, are they taking that feedback and saying like, oh, okay, like, great, I didn't realize that, this is important. Like, I'm going to start fueling before practice. I'm going to make sure to have a, recovery shake afterwards. Even if I'm not feeling hungry, I'll add more of the carbs that I need. Are they able to take in that information and apply it? Um, or is there potentially a lot of distress around that? So, these psychological components, and the psychological distress that is related to body image, behavioral symptoms around burning calories, feeling like they need to earn their food, compensatory behaviors that can make it so hard to fuel their body in a healthy and supportive way. Those are the signs that somebody's kind of leaning into beyond just REDS, development of an eating disorder, and that's interrupting their ability to prioritize their health and performance and needing more support. So, as I mentioned, like lots of athletes that I've worked with, almost every athlete that I've worked with has like some level of underfueling. So it's really common, especially as I said, after demanding practice or competition, and with rest, with proper nutrition. Most athletes are able to replenish their energy stores, continue training in a healthy way. But if an athlete continues to push themselves without refueling, this energy deficit is going to grow, and take a toll on their endurance, strength, and well-being. There are actually a lot of reports, and growing research around low energy availability from either intentional or unintentional origins, that associate these very short-term positive results, such as performance improvements, or social approval from their coach, their teammates, from the sports culture. So sometimes people start to make these changes and they see these positives and they're like, great, like this must mean I'm doing something right. Like I should, continue to be really maybe strict with what I'm eating or, my training regimen, or maybe more is better when it comes to training. Maybe lighter is faster. Um, and these short-term, like positive outcomes can make it more challenging for athletes to recognize the longer-term potential health and performance implications of exposure to low energy availability. And it really varies person to person, like how long it will take for those consequences to kind of catch up with them. So sometimes we see these short-term positives, but almost always we start to see a decrease in muscle strength, a decrease in endurance. Somebody's performance starts to plateau or maybe even decline. It increases their risk for injury. And if we're noticing more recurrent or persistent injuries, that's a sign that there's, problematic low energy availability. Um, Struggling with training response. Are we noticing more, mood disturbances? Is somebody feeling more irritable, anxious, depressed? Do they have difficulty concentrating? These are some of the signs that we want to look out for. And then on top of that, what's happening psychologically in terms of relationship with food, with movement, that might signal that somebody's needing more support or is experiencing an eating disorder.
So to shift gears a little bit, we want to talk about assessments. I think this is really important to kind of bring into here because sometimes we need some evidence, right? To show our athletes a little bit of where their relationship with movement is, maybe compared to somebody without disordered eating or an eating disorder or issues with overexercise. So we talk about three assessments here. The compulsive exercise test, which we use at Within Health. So if somebody is an athlete or is identified as somebody who struggles with overexercise, we can include the CET on the monthly outcome measures, which is so helpful. The outcome measures just is a whole different talk, but it's really helpful in a way where sometimes someone might feel stalled or they're not making enough progress, or the flip side, they're telling us everything is fine, but we're kind of seeing those numbers show us something different. And that can really open the door to a conversation as well. Then there's the female athlete screening tool, and then the AIMS, Athlete Identity Measurement Scale. So we actually used the AIMS in one of our groups not that long ago. And it was really interesting and really helpful, I think, to have a conversation with our athletes about their results from it and kind of what they learned from it. So we'll kind of break down each test, each measurement a little bit so you all can be familiar with them. So the compulsive exercise test, there's 24 items, nice and short. We don't want to overburden somebody. I mean, 24 is probably pushing it, but they can get through it pretty quickly. A 0 to 5 point Likert scale. And then the subscales, avoidance and rule-driven behavior, weight control exercise, mood improvement, lack of enjoyment in exercise, and exercise rigidity. So lack of enjoyment in exercise actually isn't something we've touched on yet, but I think is really important because sometimes if you are somebody who's struggling with compulsive exercise or maybe an athlete who's struggling with an eating disorder, you aren't even enjoying your activity anymore. You're doing it because you have to. You're doing it because like mentally you can't allow yourself to take that break, or you're worried about the consequences of taking the day off or about being flexible. So in some ways, the exercise is like really impacting your mood in a negative way too, because it just feels like a burden at this point, and they need somebody else to kind of give them that permission to take the break sometimes, which can be really helpful. Or to say like, hey, you know what? I'm hearing a lot of things from your team environment or from your relationship with the sport that kind of indicates maybe we should take a season off. And for some people, that permission or suggestion from somebody else is the permission that they need, and gives them a lot more freedom to kind of say, yeah, you know what, like the pressure from this is really impacting a lot in my life, and it is really impacting my eating disorder in a negative way. So like, let's talk about how we talk about your coach to your coach together. And then some example questions are, I feel extremely guilty if I miss an exercise session. If I miss an exercise session, I'll try to make up for it in the next exercise, and exercise improves my mood. So maybe remember I talked about a few of these earlier on in the presentation. I think this is so interesting because in my head, when I read these, I'm like, well, yeah, these questions, I feel like it'd be so obvious how this is going to score the way I answer. But that's also because I'm an eating disorder therapist who works with athletes. If you are somebody who's in it, these questions actually maybe don't feel that way at all. It might be like, well, of course I feel guilty when I miss like a workout, or like, obviously I'm going to try to make up for like going easier yesterday. And doesn't exercise improve everyone's mood? These are all things we've heard said to us. And so it's at first for me, I'm always like, how reliable is this going to be? But then when you get with an athlete who is in the thick of it, to them, that's not how this feels. So I think this is super important because then again, you can go back and kind of show them the data of this is where you scored compared to where everyone, like the controls scored. Um, and the female athlete screening tool, I think personally is really interesting because it can detect a subclinical eating disorder, which that is so important. How nice is it sometimes we can catch things before it becomes like a full-blown clinical eating disorder where they maybe need a higher level of care. It is a little bit longer, 33 questions, graded on a scale from frequently to never. And so it does take a little bit of time, 15 minutes to complete, which, sometimes if you can't get someone to complete these things like outside of sessions or treatment, like maybe doing it with them, um, it is only designed for college age female identifying clients. So that is like something that, kind of hinders the use of this sometimes. And then some questions that we see here are during season, I choose to exercise on my day off from practice or competition. Again, their mentality might be, how else am I going to get better? But then also like probing more into that, like, verbally with them in session. And then I think thin is associated with winning. And then these questions just open up the door for so many things. I could talk about this forever because that then comes down to like, do other people around you feel the same way? Which then opens the door to like team culture, coaching, messaging, family messaging. Maybe that's just internal messaging, but you get so much information. During training, I control my fat and calorie intake carefully. Oh, this is so important. Again, opens the door for beliefs around food, team, family, internal, whatever it might be. Because I think a lot of people may be misinformed and do think like, well, I have to watch my calorie intake during season to achieve X, Y, or Z, or I have to eat less fat during season to be able to achieve what I want to achieve. And then I participate in additional physical activity, greater than 20 minutes in length on days that I have practice or competition. This is important because there's sometimes the things that we don't see where it might just be like, yeah, I practice 6 days a week, but what they don't say is maybe they're running before practice or after practice, or they're staying later to practice additional skills. And I think in the sport environment, a lot of times that is praised. People are given positive feedback if they are doing drills outside. They're seen as dedicated, committed to the sport. But like, what's the motivation again behind it? I always go back to that. And then this question, I believe that most female athletes have some form of disordered eating habits. This, again, because this is only geared towards female college athletes, this can go like a question I'd want to ask in general is like, do you believe most athletes have some form of disordered eating habits? Like when having an athlete in your like session with you, because shockingly, I think a lot of people do believe that based on their sports environment and the way people around them talk about food and exercise. And again, if it's normalized, why would they think they're doing anything that everyone else isn't doing? And then the athletic identity measurement scale. So like I said, we did this in group. It was really fun to use. It's super short, 7 items. There's 3 subscales: social identity, exclusivity, and negative affectivity. And the score ranges from 7 to 49. The higher the score, the stronger the identity as an athlete. So this is super important in general because maybe you have an athlete that is really high up there on the aims and they identify so hard as being an athlete, which maybe that motivates them and they're really good at their sport because of that. However, that comes with some pretty big risks sometimes because if being an athlete is your only identity, eating disorders aside, when that athlete eventually is no longer an athlete, whether it's a professional athlete who retires, because that happens to everyone, whether it's somebody who gets a career-ending injury, a season-ending injury, they've graduated from high school and they don't compete professionally. Like, what does that mean for that person's identity if they've only ever known the athletic identity? They're going to go through the feelings of loss and like things might feel out of control. And then you have athletes with eating disorders who then maybe identify really high on the scale. And for that is a huge risk because when we ask them to step back, or maybe if they get an injury, like their eating disorder can sometimes, really be then like their identity now that we've lost the athlete identity. So I think it's interesting because a lot of times people might be like, oh, it's so good to identify as an athlete, but like we don't want that to be your only personality trait or the only way you can kind of see yourself. And then really understanding these subscales. So social identity, this is basically if an athlete perceives themselves like if their athlete's like social network is only as being an athlete. That can be really hard because if you are somebody who then maybe experiences an injury and like your whole social network is your team, like what does that look like? You can still obviously hang out with your team, see your team after practice, after games or meets, but you're losing a lot of social time on like the field or in practice together. Um, and then exclusivity, the degree to which someone's self-worth is determined by their athletic participation. So this can be risky as like you're relying on like an over-reliance on sport for your self-esteem. So your only sense of self-worth comes from being an athlete. And this is tricky not only because one day things will shift and people will become an athlete in a different way, but because if you have a poor performance, everyone has highs and lows. Even the best people don't always perform at their best. So if your self-esteem and self-worth is reliant on your athletic identity and you have a bad meet, a off season, or you're suffering from overtraining syndrome, that's going to take a huge hit emotionally. And then again, feel like a little bit of loss of like identity there. And then negative affectivity, the extent to which unwanted athletic outcomes can cause negative emotions. And so this can be like kind of signaling like vulnerability to stress following an injury, or I was supposed to say a high score, it says high school. But a high score can indicate be like a signal that you might feel really poorly, like I said above, with the exclusivity part of following an injury or poor performance. Because again, if you're an injured athlete and like your identity is so tied into being an athlete, you don't know what to do with yourself, and that can lead to an eating disorder or substance use or other maladaptive coping skills. Because a lot of times I've gotten athletes into my office post-injury, so a lot of things were masked due to the participation in sport. But let's say they tore their ACL and are now out for a while. You always will see in the intakes, like eating disorder developed post-surgery. And, that's, kind of an indicator right there that things beforehand probably weren't great, but the sport kind of masked it for them.
So we want to preface that, a team approach is important for treating anybody with an eating disorder. We want to be able to address difficulties from a psychological, nutritional, and medical standpoint. And when it comes to treating our athletes, we're adding another layer of risk for complications because of, in medical complications specifically, because of how active these clients are and putting the additional strain on their body along with some of the pressures to perform. So therefore, we need to have a treatment team approach to match that risk and like level of support needed from all angles. So, we have the psychologist or therapist, the registered dietitian who, hopefully also has a good understanding of sports and sports nutrition needs. A medical provider, psychiatrist to support for any medication changes. And then, making sure, and this feels especially important. I mean, it's important always, but like in a virtual program as well, like, what does their support system look like? How can we loop in family, parents? Sometimes clients have, teammates who they want to be a little bit more involved in their care. So we have that support system outside of program. Are we doing family therapy? Does that feel important or relevant for some of our athletes? How can we also utilize the coaches? Are coaches open to communicating with us and working with us to support an athlete who is in treatment? We've had athletes who come in and their coaches are really great of like, okay, we're happy to take on the role of like making sure that this athlete has a snack before practice, eats their snack after practice before they go home, and helping with that additional accountability. That can be really, really valuable, especially when an athlete and or their family also has a lot of respect for the coach. That can be an extremely valuable relationship to build in this like treatment team model. Um, Athletic trainers, physical therapists, how are they able to support athletes and having open communication with the athletic trainers, physical therapists that clients are working with? If somebody, as Michelle touched on, like, we sometimes have athletes who come in and they're on a scholarship and they're really worried about their place on the team, maintaining that scholarship. Can we build some rapport and communication with the athletic administration in order to better support this athlete. And again, if their goal is to get back to their sport, like these pieces are really, really important in order to get them back to where they want to be, and being able to support them from all angles.
All right, so let's talk about the role of the coach. Because I think maybe this is just like from the perspective that I had, but it isn't until more recently people have really thought about, do we get the coach involved in treatment? I feel like the answer is always yes. Because even if the coach is delivering problematic messages, education goes a long way. And something that I think we've learned as providers on certain cases that Kat and I have shared is that the coach maybe necessarily isn't providing problematic messaging. It's actually like maybe something the athlete's fear is like projecting onto the coach, or the coach is going to say this, the coach is going to do this, when actually it's like, well, let us just talk to the coach. And then we kind of find out actually the coach is willing to support anything we recommend. So that is a really good learning point, I think, for all of us, because we're hearing from our athlete, no, no, the coach won't let me do this, or the coach is gonna be mad if I don't do this, the coach this, the coach that. Let's just talk to them to see where we're at. Um, but why they should be involved in treatment? Your coach spends the most time with your athlete, especially if you're in a college setting, because they are with the athlete at practices, at meets or competitions. They're traveling with your athlete. They're seeing them a lot. They're also seeing social dynamics with the athlete around the team. So they're kind of like being able to notice, like, hey, is this person becoming like more withdrawn? Are they isolating themselves from the team? Are they not eating with the team? Just really kind of looking at like what's going on. And even like for our younger athletes, they're with their coach every day after school for hours. They are also clued into a lot of what's going on for this athlete, like emotionally and socially. And so, like I said, like there's just so many opportunities to observe the athlete if they're willing to. I would never ask a coach to sit with an athlete for a snack. Like maybe just check in with the team, and like if the whole team, or check in with like our team or treatment team, that if the athlete's traveling with their sports team and we happen and you notice that like they're not eating snack when we've agreed upon, they don't need to say anything, but like we just need to know as the team. And like having an open dialogue of like the coach saying, like, yeah, I'm going to pass on to your treatment team things I notice that maybe aren't supportive of your recovery. Um, and I think whether the coach likes it or not, they have a large influence over the athlete, because of like what Kat said earlier is that a lot of athletes look up to their coach. They view them as a role model. And I think sometimes when people sign up to be a coach, they're signing up to be a coach because they have a passion for the sport. And they might not even consider, I'm going to be a role model for these athletes. I'm going to be someone who helps like kind of shape their development. That's a big role. It's a big role to play. And it's not always something that a coach is expecting or asked for. And, unfortunately, it's sometimes a position that they're put in. And so I think it's just working with them and talking to them about what that means and kind of like how that looks. Um, and making it very, very clear. They can be used to like help motivate the athlete towards like going to treatment or in recovery, but they are not expected to be this person's therapist. I mean, again, I kind of say like, I guess a coach likes it or not, they hear a lot. So sometimes like I think about my high school running coach and the stuff he heard on long runs with us. That poor man, like probably heard more than he wanted. But I think like because of that, like they just like get sometimes emotions put on them. And so I think that really kind of being clear, like, hey, you don't have to do anything with this. Like, you can listen if an athlete comes to you and kind of be like a sounding board, but you don't expect it to be this person's therapist. But I think sometimes the coaches are put in that role, whether they like wanted to be or not, just because they're around the athletes so much. Sometimes attending a team meeting can be so helpful, like a treatment team meeting, because then it shows that we're all on the same page. Like we are in this together to support you, and being clear that like we're there as a support for recovery, because it can sometimes feel like we're ganging up on the athlete, I think is what they would feel like a lot, like, with the coach there, the treatment team there, the parents there, everyone's there. But it's we're there to support your recovery and making sure that message is very clear. And then, like I've said about how much time a coach spends with someone, they are often the first person to notice an eating disorder. And they sometimes are the first person to say something, whether it's directly to the athlete, to the athlete's parents, to someone. And so I think it's really important to just, you have this like untapped resource to use them if they're willing to be involved. And if they're not willing to be involved, that's okay too. Are they willing to like hear information about kind of just like what's going on for this person, and maybe even like some psychoeducation can go a long way too. And then we did talk a little bit about sometimes like athletes need a break from their activity due to where their eating disorder is at. If they don't have an eating disorder, maybe they're injured. But like, how do we keep athletes engaged while they're in treatment? Because I think a really big fear for athletes is I'm going to go to treatment and you're going to tell me I can't exercise anymore. You're going to tell me I have to quit my team. Of course, that's a huge fear. So we want to make sure that we're always mindful and thoughtful with how we approach this. Um, so like I say, my first point is like if they're benched initially, they might lose motivation or experience increased levels of depression. So sometimes when we have athletes come in and it's kind of clear the trajectory this is going, and they might need to take a break of just laying it out there. We think longer term, a break might be helpful for you, but we understand where you're at right now and we want to help you get there. So, not going from full participation to nothing, pending medical stability, medical clearance, all that stuff. We want to help kind of taper you down because that can sometimes feel a lot better. And a lot of times it feels more like less of like more supportive and less of like a blow to the athlete. So especially like when things come up as well as maybe someone has a history of self-harm, and as you start to taper down their exercise, their self-harm urges increase or they begin to engage in self-harm again. That's okay. We know how to work with that as well. We know how to support somebody engaging in self-harm. We help support them in kind of both ways. And maybe we just pause on the taper and we keep it where it is while we try to manage both and then continue the taper. And also just acknowledging that it's normal to feel this way if you initially are kind of taken away from your activity. Making clear goals. I amount of times I've heard athletes say, well, yeah, I'm now on this exercise break and I have no idea when it's coming back, or I have no idea what to do to get it back. Sometimes, again, going to the source, it might be that it's been laid out and they just are too overwhelmed to hear it, and that's okay, bringing it back to them. And sometimes they don't, no one's told them. And so I always encourage, be an active participant in your treatment. Like ask these questions. You're not putting anyone off by wanting to know clear expectations. And I think that can be really motivating to know, like, okay, I just need to be this way with my meal plan compliance. My vitals need to be stable. I need to rate restore. Like these things can really help an athlete kind of get to their end goal of re-engaging in their activity. And then keeping the athlete engaged in team events, that just varies but based on like what the athlete is willing to do, what they're able to do. I had an athlete who left school mid last semester and just didn't even say anything to her team, just left. And so we worked a lot on how do you like the team was her life and she just kind of disappeared. So I also talked about like they might be worried about you too. So really working on ways to like re-engage, whether it's just like contacting the ones you're closest with, re-engaging in the group chat, maybe letting some people know what's going on. Like all these things can be really helpful. Attending like the team studies together in someone's dorm room, going to that, like the team used to do like a TV show night. They'd all watch, I think, Survivor or something together. I was like, please go to that, like be involved in that. If they're able to, like attend practice, kind of go and like for some people that's super hard. So again, this is very individualized. Some people are like, yeah, I'm not going to practice and watching everyone else participate in this and I'm going to sit in the sidelines. That's fine. Some people it might be, yeah, I'll do that and I can like help the coach set up drill stuff or I can just kind of like be there so I like know what's going on. And then if possible, so a lot of our athletes, if they're in like a skill sport, like a technical sport, can start re-engaging in the skills before they can re-engage in full practice. So whether that be like technical things, dribbling, shooting, passing, throwing, whatever it might be, just ways to kind of keep them looped in so they can feel that if that's like part of their motivation to recover, they can still feel that. So Kat will talk to us about what we do within in terms of our levels.
In terms of our movement levels, because, in taking into consideration, of course, like our athletes and everybody within, like we want all clients who come in and work with us to, experience a more like supportive relationship with movement if that's what they want. And so we have what we've designed as like different movement levels to kind of tell us like where, what's the priority at this time and what is somebody able to engage with in terms of movement. So we start with our courage movement phase. This is for clients who are needing to prioritize intentional rest. If somebody is experiencing any medical instability, significant weight restoration, from a psychological standpoint, if they are, really struggling with taking a rest day or engaging in movement without going beyond the recommendations, if they're needing to significantly increase their food intake and variety of foods in order to set the foundation before we introduce and increase movement. Is somebody experiencing an absence of menstrual cycle or irregular periods? Is hormone production down for any athlete? These are things that we would take into consideration and might, lead to that conversation with somebody of like, hey, this is where we need to prioritize a full pause. And we're very, very intentional about calling it a pause. This is not something that is going to last forever. And sometimes we can give really clear guidelines of like, this is what we need to see in order to get you to, step up to our next level in movement and be able to start re-engaging. Other times it might not be so clear depending on how somebody's body is responding to the nutrition and vital sign stability piece. But we do still have some movement groups that these clients can participate in. Breathe and stretch, meditation. We have a movement psychoed and process group. We have an athlete focused movement psychoed and process group where clients are able to start talking about their relationship with movement. And as Michelle mentioned, majority of the time, especially for our athletes, like there are both really authentic driven reasons for them to uh, engage with movement and participate in their sport. And there's also eating disorder driven things. So how can we start even before somebody is, if somebody's not able to engage in movement at this time, like we can start to tease that apart and start to have those conversations so that, we also can support them best and like where's going to be our best place to start. Some of these like breathe and stretch meditation, chair yoga, like these are things too that help clients and our athletes to like reconnect to their bodies, because oftentimes we do see there's this really big disconnect that can happen between pushing your body really hard and doing this strenuous activity and engaging with a lot of eating disorder behaviors. How can we bring back clients back into connection, and this can be a really nice step. And then we have our determination movement level, where, client might still be working on weight restoration, increasing food intake, challenging fear foods, working on eating a wider variety. Is there a return of menses if applicable? Client is medically stable, and can they, follow recommendations and guidelines with oversight? And this is also a really important piece, taking into consideration the virtual nature of our program, that okay, when we have somebody in the determination phase, or level with movement, whether they're coming in that way or we're working on introducing that or stepping up from courage, okay, can we be really intentional about like, when are we going to build this in during the day? Can we, do these 30 minutes? Can you make sure to, are you with somebody beforehand? Like, do we have a session, or can you check in with one of our care partners afterwards? Really important that they are not most of the time doing this kind of movement on their own. Like they have some support and somebody with them, whether that's family member, support person. Maybe this is, a step into, getting to participate 30 minutes of practice, and having that accountability and support from other people, and kind of sandwiching it with some support from the treatment team as well, if applicable. The intensity shouldn't be too, no, no worries. Shouldn't be too high. An athlete should be able to, or client should be able to carry on a conversation with limited need to pause, shouldn't be super out of breath. A few other groups that we can add in and they can start engaging with in program, flow yoga, Pilates. So these might be things that we can add if we're able to build that into a client's schedule as well. And then we have our perseverance phase. Somebody is doing a great job with meeting their meal plan and they've stabilized nutritionally. They are ready for, the additions. Like I always like to ask, especially as we're getting into, higher intensity, higher frequency of movement, like, do you feel like you can increase your food intake to account for the increase in training? And if there is any hesitation or uncertainty there, like that feels really important for us to unpack and probably spend quite a bit of time in sessions unpacking before we say, okay, we're going to jump in. Where's the hesitation if there is any? What can we do to make this feel more realistic? What are maybe some like challenges that we need to continue to incorporate both in program or outside of program, in order to get you to a place where you can start to have maybe up to even like 60 minutes of movement, uh, and be able to feel confident in fueling for that level of movement. The supervised exposures here again are very important, especially when it's something that there was like some previous dysfunction with this form of activity or sport. So sometimes it's really clear for people that like, oh, I would go to my sport and then in addition, especially around when my eating disorder started, I would be exercising in my room. And I'm able to identify that participating in my sport feels really authentic. And, I'm not as worried about my eating disorder kind of taking over, especially being in the team environment. But like, it's a clear sign to me that this is a disordered intention if I'm exercising in my room by myself later in the day, or before school or something along those lines. Or sometimes it is that like, maybe we have a runner who comes in and, they started, doing more training beyond what was approved or recommended by their coach, and like, okay, how do we take that into consideration? Like they're going back to the same type of movement. What can we do again to make sure that they have a lot of support and containment when reintroducing this? And this is something else where we would say, okay, do we have time in between these groups? Or can we really strategically schedule your therapy session, dietitian session, care partner session after you're planning on going for your run, so you have space to process it. And if there's a concern for overdoing it, like, okay, I know I have this time constraint around it. Those are some things that can be really helpful, again, considering our uh, flexibility as a virtual program. And then we have our empower phase. This is really, see this the most with the clients who are really ready to step back out to outpatient. We want to make sure that they are solidly set up with outpatient therapist, dietitian, sports dietitian, if applicable, or being able to connect with maybe the sports dietitian at their school, if they're, for example, a college athlete. They are at least within 90% of their biologically appropriate weight, experiencing, very minimal to no obstacles to the nutrition rehabilitation process. They're doing well with meeting their meal plan. They are taking a lot of ownership and autonomy with fueling, with engaging with challenges, as recommended by their treatment team. Um, and like this is a phase where definitely the intensity is going to be higher, and might be able to say some short phrases if needed, but wouldn't necessarily be able to hold a conversation. And so being able to also vary the intensity. So, okay, just because I can engage in this higher intensity now doesn't mean that that's what I'm going to do 100% of the time. Is there also flexibility? And that's something else we would be looking for on top of, can somebody fuel well? Is somebody still able to take their rest days? Still engaging in some of the groups at within, and having that balance and shift in like the types of intensity that they're doing and connecting with their body in different ways. And with this in mind, one of our fantastic lead dietitians took the lead in creating some guidelines adapted from the Safe Exercise at Every Stage guidelines on how we are deciding what movement level somebody is ready for and makes sense for them. So if somebody is on courage, as we mentioned, like there might be some medical instability. The CET score might be greater than or equal to 15. Like that's something we want to make sure that we're giving to clients from the get-go if we're worried about compulsive exercise. What are the labs showing? And we are reviewing this every week. We meet as a treatment team each week, and checking in with, okay, is this still necessary? We want to be able to, give our athletes more insight, especially when, as Michelle mentioned, it's helpful for them to have some goals. Okay, like what kind of information and insight can we give them to know when they're ready for the next step? The determination phase, we're making sure to review this at least, every other week. What are we seeing in terms of weight gain, if applicable? If somebody is weight restored, are they able to maintain their weight at their current meal plan? Are they, able to add more food? Are we starting to have those conversations in order to adequately fuel for the activity that they ultimately want to be doing? We want to take into consideration, how is somebody potentially not getting their period? How long has it been? We want to make sure that we're taking into consideration like what's happening with their hormone health. What do we need to do to ensure that, their body is getting the optimal energy that it needs, not only to, add in and support, adding in more exercise, but having that really solid foundation of like the body trusting that it's going to get adequate fuel and nutrition always. And then perseverance, weight stabilization. If weight gain is still required, how is somebody doing with that? Are they able to be flexible, or like, hey, we're noticing that, there's kind of been what looks like a mismatch of energy, maybe based on recent weight trends. Vital signs, like we need to make modifications. Are they able to be flexible? How are we managing the eating disorder behaviors? Is there a significant decrease in purging, restricting, binging, preoccupation with body shape and size? Are we able to have these open conversations, and work on managing that in a more supportive or healthy way? Um, Again, this kind of highlights a little bit more this chart of like, what are we looking at for courage versus determination versus perseverance, giving us those guidelines of like, what's the appropriate intensity, duration of structured movement, stretching, is somebody approved or is it supportive for them to engage in, cardio or respiratory exercise? What might resistance exercise look like? What's the setting in which it feels like it might be appropriate for somebody to engage in certain levels of movement? And is supervision needed or not? And doing some of the initial education. So as I mentioned, like the education and the starting to like tease apart what feels authentic and what feels eating disorder driven can always start at the courage level of care. We don't need to wait for somebody to start re-engaging in movement, to start to give them that education and support in being able to get back to movement and their sport in a more authentic way. So I know I touched on these a little bit, so this will be pretty quick, but we do have a variety of movement groups at Within, breathe and stretch, flow yoga, chair yoga, Pilates, strength training. We have emotion, so like movement classes that combine dance, yoga, repetitive, playful, and creative movement to support somatic access, movement and processing of emotion. I actually love when athletes engage in some of these groups because it can be really challenging sometimes for them to look at movement in a way that's like lower intensity. And like we often talk about like what quote unquote counts as movement and starting to challenge that and reframe that because we hear a lot from a lot of our athletes that like doesn't feel like it counts unless I'm doing something that I'm going to be out of breath or I'm sweating. And how can we start to expand our definition of movement? And again, I think a lot about the disconnect that can happen from like our clients and athletes from their bodies when an eating disorder has been present, when they're putting this strain on their bodies. And how does sometimes slowing down and moving in different ways help them bring back in this connection? So then once they, start to get to that perseverance or empowerment phase where they're doing more high intensity movement, there is more of that connection and support. And then our athlete focused movement process and psychoeducation group, we started that in June. Michelle and I run that together. It's really awesome because we get to do a lot of like the talking about relationship with movement, and we also get to bring in the sports nutrition piece and giving our clients and athletes starting their sports nutrition education and foundation during this time. So that's been a really great addition to what we can offer our athletes as well. Okay, we do have some time for a case study. So this is an athlete who was in our athlete-focused movement process and psycho-ed group, and Michelle and I both got to connect with this athlete one-on-one for some individual sessions as well. She is a 24-year-old female soccer player, formerly played soccer at the collegiate level. And this is actually like really good example of somebody like that Michelle talked about where okay, I've been playing soccer my whole life. I played through college, and then there's this huge shift in identity when graduating from school and stepping out into grad school and the workforce and not having her sport as that anchor and like big form of identity anymore. And it really kind of masked a lot of the eating disorder behaviors because she's very motivated in season. Okay, I'm gonna make sure that I'm fueling around my training sessions. Like I know that it's important to get in enough carbohydrates to support adequate muscle glycogen stores. But then in the off season where there was less oversight, less of that day-to-day support and movement and training looked a lot different and the intensity looked a lot different, a lot more rigid rules would show up. She actually started seeing an outpatient dietitian who that specializes in eating disorders and sports nutrition around like age 17, and initially was seen for REDS. Was like, oh, I think that this is what I have. And it took quite a bit of time for her to come to terms with the fact that she did have an eating disorder, and this was beyond just REDS. She really struggled with being able to take rest days and eat enough food to support the amount of activity that she was doing. Carbs and fats were a huge struggle. This was her first time in higher level of care treatment. And she's somebody, as Michelle mentioned, like ideally could have used likely a full pause. And that was not going to be totally realistic for her coming in. So we started to explore, how can we start to shift relationship with movement, engagement with movement as we're working on increasing food intake. So we did a lot of work from the nutrition side of like education around like resetting the foundation needed so that, body can feel better and have like optimal health well-being on top of performance. She had asked about, like her ultimate goal. She wasn't training for anything at this point. She's playing co-ed soccer for fun. But, has talked about maybe wanting to train for a marathon in the future. That's something that, she thinks she would be interested in, but there was a lot of uncertainty of like, it's hard for me to tell what feels truly authentic and what I enjoy when it comes to movement and what's feeling like it's coming from a place of need because I will feel anxious or guilty if I don't engage in this way. She did have a good amount of support at home. She was living at home with both of her parents. She was working. She, has a partner who is really supportive of her process. Um, and, we were able to start breaking things down a little bit more, doing a little bit more of the education. How can we apply some of the challenges, challenging her eating disorder with adequate carbs and fats at meals and snacks, especially those in program. We talked about the amount of movement and type of movement that she was doing, and initially, running 3 to 5 miles every day, lifting 4 days, walking, daily, just like also starting to identify like, oh yeah, I think I'm kind of like muscling through all of my workouts. And just kind of like, oh, if I'm tired after a workout, it's probably just because like I need to get more sleep. And it took her a little while to admit like, yes, I think that food is also playing a role. And when we were talking about like the types of movement that she was doing, she was able to identify like, okay, I'm lifting 4 days a week because I feel like I should, and I hear where this is a really positive thing. So we did some education about how, and I'm thinking about the talk that Chrissy and Mary did yesterday on like bone health and how like, yes, weight training can be really supportive for bone health as long as we are eating enough food to support it. So able to do some education with that athlete about that. And then she was also able to identify like, actually I hate like weightlifting because it reminds me of the Olympic lifting that we needed to do in college, and that was terrible. So that was when we were like, okay, we're gonna do away with that. Like, as you're working on resetting the nutrition foundation, like let's not do it. You hate it. Let's focus on getting rid of this at this point, and can reassess that in the future, maybe an outpatient. And she was able to do that pretty easily. So there um, there was there was a lot of support around that and some things that she was able to, engage in really quickly. And other things that were still a challenge and kind of I want Michelle can speak to this a lot more. I think like the okay, I have these negative thoughts about food or my body or exercise or like these disordered thoughts. Like how can we be intentional about challenging them rather than just kind of letting them run the show?
Yeah, something that when we met or a few times when I covered, and we had this client in group was a lot of things they were kind of used to was just like pushing through because I think, the athlete in them was used to pushing through discomfort, emotional, physical, whatever, to keep going. And when they were talking about their thoughts or disordered thoughts that were coming up, I was like, what are you doing with these thoughts? And she kind of just stared at me and was like, I'm just like, we're just moving on. And I was like, no, no, no. Like, you can't just move on because you may think by not like diving into them emotionally, that's not doing any harm. But if we're not acknowledging them and challenging them, they're still vibrating like in the background and like still dictating movements that you do like intentionally. And so you really need to like take away that mentality of just pushing through everything and stepping into this intentional mentality of how do I acknowledge, how do I challenge? And something that like was really cool for us to do together is again, a lot of our athletes are used to, I don't feel that great today, like I'm a little sore, I'm a little tired, I don't feel as hydrated as I should, and they're just doing it anyways, right? But I was like, this is not what we want to do. So I want you to check in with yourself, check in with your intention before your run. So, like, how do you feel mentally, physically? Why are you going on this run? Maybe like pop some awareness into it mid run. I said, just do a quick check in with yourself of how things are going. And then also at the end, jot down your thoughts as well. That way, there we can really tease out what's going on. And like maybe the run starts with good intentions, but maybe a couple miles in, the intention might shift a little bit and be like, well, I've only run 2 miles. I need to get to this distance, or I need to get to this time, or I need to burn this many calories. And then how do you feel at the end? And again, I really like to explain those thoughts don't mean you can't do this activity. We need to get into those thoughts to like push them, to challenge them, to see what we can do with them. So you're not just kind of left with them, like I said, like vibrating in the background. And a lot of work for this client was like dipping into the emotional piece of it. So having them do some behavior chains when post behavior, but instead of like looking back at like what was happening throughout the day, looking back to like when this event happened, how did you feel? And really like touching upon that so we can get to when you did engage in a behavior, these were all the emotions that came leading up to it. So it was the client also like did a lot of their own work outside of it. And that's the kind that came in and said, I think I have overtraining syndrome. And we were like, oh my God, that's so great that you figured like you looked this up and we can talk to you about this now. So yeah, that's one of our little athletes that we've been working with. And I see Jamie's back, which tells me we are almost at time.
Yes, you guys are doing such a great job. I hate to have to hop on and end it, but we are getting close to time. And we did have a question in the chat, and I wanted to make sure that we addressed it. This is coming from Susan, and the question is, can you touch on considerations when working with athletes who are middle age and seniors?
Yeah, I guess I have a question. I don't know if you meant like more nutritional considerations or like physical considerations. I guess Kat, you could probably speak to like nutritional considerations.
Um, I would, I'm trying to think of like how best to answer this question.
Are we on the right page, Susan? If you want to add more, we're happy to. We just want to make sure that we address your question correctly and thoroughly if you're still out there. But if not, let's take a stab at it.
I think that like with any athlete, like regardless of like yes, we're going to take age into consideration for our adolescent and developing athletes, for our collegiate athletes, and also for our yes, like our middle age and senior athletes. Can we again look at like where's the foundation nutritionally? Like we know that there are lots of benefits to movement that have nothing to do with changing body shape, size, weight. We want people to be able to engage with that if that's something that feels supportive for them and that's something that they want to do. And always making sure like where's the foundation nutritionally. I'm going to bring it back to again, like, Chrissy and Mary's talking about perimenopause and eating disorders that like from a bone health related standpoint, this is, where my brain is going initially, that, there's going to be more detriment to doing more movement resistance training if somebody's not eating enough to support that. So again, we would do the same kind of sports nutrition education, fueling around activity, considerations for calcium. Has this person gotten a DEXA scan? So, from a nutrition related standpoint, that's automatically where I go.
Very good. I would say there's a lot of love in the chat and a lot of comments. So if you all have not had an opportunity to see that, but you're getting a lot of love in the chat and just people relating and just validating some of the things that you said. Thank you, Susan, for your question, and thank you all for your participation, as it is always welcomed and so valued. Michelle, Kat, excellent presentation, great information. And that is the conclusion of this session, and we will see you all in just a moment for our next session. Thank you so much. We'll see you soon. Bye.